Chapter 31, Treatment of Cancers. We'll skip over the terms and definitions. We'll cover them in the chapter. Cancer is a disease that occurs when the normal cell renewal process fails. When old cells fail to die and new cells form more rapidly than needed, the cell may accumulate and form a mass called a neoplasm, which is just a fancy name for a tumor. Tumors are caused by abnormal cell division, and they may be benign or malignant. A malignant tumor is cancerous and can invade and destroy nearby tissue and spread via metastasis to other parts of the body, where a benign tumor is not cancerous and does not spread. Specific cancers are named according to the site at which the cancerous growth began. This is the site of the primary tumor. For example, with melanoma, cancerous cells form in the skin. Cancerous cells and blood-forming tissues lead to leukemia. In osteosarcoma, bone-forming cells become cancerous, and in lymphoma, cancerous cells form in the immune system. Box 31.1 shows us the risk factors for cancer. Increasing age. Tobacco, a huge one, huge. Every cancer is linked to tobacco in some way. So if you're a smoker or know someone that's smoking, you are definitely putting yourself at a higher risk for cancer and many other diseases. Environmental pollutants. So I'm sure you've seen commercials about like the Roundup lawsuit. People that farmers and people who use Roundup were having some cancer issues. So I'm sure you see lots of stuff like that. I can't think of anything off the top of my head besides that. But yes, that's a major cause as well. Also, if you think about the sunlight and tanning salons, those are going to be a huge risk factor for developing skin cancer. Carcinogenic chemicals, so those can put you at risk for developing cancer. Bacteria can, viruses, hormone therapy, and then family history and alcohol. The risk for developing cancer increases with age. Cancers are more prevalent in people over the age of 65. Inhalation of cigarette, cigar, and pipe tobacco may increase the risk for developing cancer of the lungs, larynx, mouth, esophagus, bladder, kidney, throat, stomach, pancreas, and cervix, and acute myeloid leukemia. Smokers as well as non-smokers exposed to secondhand tobacco smoke are at increased risk as well. Chewing tobacco can increase the risk for oral cancer. X-rays, nuclear fallout from atomic weapons testing or leaks from nuclear power plants, and radon gas are examples of ionizing radiation. Exposure increases the risk for the development of leukemia, thyroid cancer, and breast cancer. Exposure to radon gas may increase the risk for developing lung cancer. Exposure to sunlight is necessary for the skin to make the hormone vitamin D. Excessive exposure to the sun's ultraviolet radiation can increase the risk for skin cancer, which is melanoma. The ozone layer of the atmosphere provides protection from excessive exposure to UV radiation, prompting concerns over depletion of the Earth's ozone layer. UVA levels are highest during midday, whereas UVB levels are found throughout the day. Exposure to UV light from sun lamps and tanning booths also increases cancer risk. Cancer-causing chemicals, carcinogens, are found in the workplace, home, and environment through pollution, industrial solvents, cleaning fluids, pesticides, and used engine oil are examples of hazardous chemicals. Known workplace carcinogens include benzene, vinyl chloride, polychlorinated biphenyls, asbestos, cadmium, and nickel. These carcinogens may get into the environment through improper disposal or chemical spills, or they are particulates that are released into the air in the process of incineration. Exposure to some viruses or bacteria may increase the risk of developing certain cancers. H. pylori is a bacterium known to cause peptic ulcer disease. PUD is associated with stomach cancer. An oncovirus is a virus known to cause cancer. Epstein-Barr virus, a common virus that remains dormant in most people, has been associated with lymphomas such as Burkitt lymphoma and immunoblastic lymphoma. The virus is also linked to nasopharyngeal carcinoma. Hepatitis B virus and hepatitis C virus are linked to liver cancer. HPV is a virus that causes genital warts and cancer of the cervix. HIV and human herpes virus 8 can cause Kaposi sarcoma. Human T-cell leukemia virus type 1 is a retrovirus that can cause leukemia and lymphoma. Hormone replacement therapy and dithylstilbestrol have been linked to specific cancers. Hormone replacement therapy and dethylstilbestrol have been linked to specific cancers. HRT, once the principal treatment for menopausal symptoms, is now limited because of the risk for the development of breast cancer, heart attack, and blood clots. DES is an estrogen type drug that was taken by pregnant women between 1940 and 1971. Girls born to women who took DES have a higher risk for cancer of the cervix than girls born to women who did not take the drug, and women who took DES also have a higher incidence of breast cancer. It is not known why one individual will develop cancer, whereas another does not. With the exception of cancers of the breast, ovary, prostate, skin, and colon, most cancers do not run in family. For example, if a father develops stomach cancer, his children have no greater risk for stomach cancer than a non-family member would. Chronic alcohol consumption, up to 2 drinks daily over a period of years, may increase the risk for cancer of the liver, mouth, throat, esophagus, larynx, and breast. A diet that is in high fat may increase the risk of cancers of the colon, uterus, and prostate. Cancers of the breast, colon, esophagus, kidney, and uterus are higher in individuals who have little physical activity and are overweight. In 2017, the 7 most common cancers in the US were breast, prostate, lung, colon, rectum, skin, and endometrium. Breast cancer is the most common cancer in the United States. The incidence of prostate cancer increases as men grow older. The median age of diagnosis is 66 years old. Lung cancer is the second most common cancer in men and women. Only breast cancer and prostate cancer are more common. A history of smoking is the primary cause of small cell lung cancer. Other risk factors are increasing age, exposure to cancer-causing substances, radiation therapy, and medical imaging, air pollution, and family history. Cancer of the colon and rectum affects millions of Americans. Skin cancer is one of the top 5 most common cancers. Skin cancer is divided into 2 categories, melanoma and non-melanoma. The most treatable form is non-melanoma. Non-modifiable risk factors for developing skin cancer are having a fair complexion, personal and family history of skin cancer, or a weakened immune system. Modifiable risk factors are excessive exposure to UV light from the sun or UV lights used in tanning salons, or a history of severe blistering sunburns. Protection from harmful UV light is the best way to prevent skin cancer. This can be achieved by wearing protective clothing when outdoors and using sunscreen. The cervix is located at the neck of the uterus, and the endometrium lines its inner surface. Endometrial cancer most commonly affects postmenopausal women. Cancer of the cervix is linked to HPV and exposure to the drug DES while the fetus is still in the uterus. Early diagnosis is critical to successful treatment. A screening test is recommended for the early diagnosis of breast cancer, colorectal cancers, cancer of the cervix, and prostate cancer. A mammogram is a screening examination used to detect breast cancer. A radiograph is taken of the breast and inspected for evidence of tumors. Sonography is another alternative way to screen for breast cancers. If a lump is found, a biopsy is performed. A biopsy is a procedure whereby the cells or tissues are removed for examination by a pathologist. Regular self-examination of the breast is another important method for screening for breast cancer. Tests to screen for colorectal cancer are the FOBT, colonoscopy, sigmoidoscopy, double contrast barium enema, and digital rectal examination. Another method of detection is to identify the presence of a tumor marker in the blood, other body fluids, or tissues that may signal the presence of a certain type of cancer. For example, a prostate antigen or prostate specific antigen test is performed to screen for prostate cancer. A Pap test is a screening test for cancer of the cervix. Cancer may be treated with chemotherapy, biologic therapy, radiation therapy, and surgery. Chemotherapy is the use of drugs to kill or slow the growth of cancer cells. Biologic therapy is the administration of immune system modulators to boost the body's natural defense against abnormal, invasive, and cancerous cells. Radiation therapy, the use of high energy radiation from X-rays, gamma rays, neutrons, and other sources can be used to kill cancer cells and shrink tumors. Some patients may try complementary and alternative medicine, which may include dietary supplements, herbal preparations, acupuncture, massage, magnet therapy, spiritual healing, and meditation. Stem cell transplantation, another form of treatment, is a procedure that replaces cells that were destroyed by cancer treatment with stem cells. The following factors influence the selection of treatment: the type of cancer, the stage of cancer, the individual tolerance for adverse effects of treatment, the patient's age, histological and nuclear grade of the primary tumor, capacity of the cancer to metastasize, and staging is a method used to describe how far the cancer has progressed within the body. It is based on the size of the tumor, whether lymph nodes contain the cancer, and whether the cancer has spread from its original site to other parts of the body. Table 31.1 shows us the summary of the cell life cycle. Figure 31.2 shows us the site of action for chemotherapeutic agents. Pharmacotherapy for breast cancer includes the administration of selective estrogen receptor modulators like tamoxifen, ER downregulators like fulvestrant, aromatase inhibitors like anastrozole, and kinase inhibitors like palbociclib. Pharmacotherapy and tamoxifen are indicated for the treatment of ER-positive breast cancer that is non-invasive or invasive, which is metastatic. Tamoxifen is approved for the treatment of metastatic breast cancer in premenopausal and postmenopausal women. It is also approved for the treatment of metastatic breast cancer in men. Tamoxifen is a derivative of tamoxifen that is indicated for the treatment of metastatic breast cancer in postmenopausal women. Raloxifene is indicated for the treatment of osteoporosis, not the treatment of breast cancer. It has a secondary indication to reduce the risk for invasive breast cancer in postmenopausal women with osteoporosis and or at high risk for invasive breast cancer. Tamoxifen should not be taken during pregnancy, and the warning label "avoid pregnancy" should be printed or applied to the prescription label. Tamoxifen, tamoxifen, and raloxifene are selective estrogen receptor modulators. They compete with estrogen. Tamoxifen, tamoxifen, and raloxifene are selective estrogen receptor modulators that compete with estrogen for binding sites. Tamoxifen and tamoxifen commonly produce menopause-like symptoms such as hot flashes, sweating, vaginal bleeding, vaginal itchiness, discharge or dryness, nausea and vomiting. They may additionally cause menstrual changes. Agonist effects on the endometrium doubles the risk for endometrial cancer. Other adverse effects are pelvic pain and ocular changes, and they are contraindicated during pregnancy. A dangerous drug interaction can occur that may cause a hemorrhage when tamoxifen is taken with the anticoagulant warfarin. So for the torremifene, the brand name is Farston. That one is only available as a 60 milligram tablet. Tamoxifen is available as a 10 and 20 milligram tablet and as a 10 milligram per 5 ml solution. Fulvestrant is indicated for the treatment of ER positive, HER2 negative metastatic breast cancer in postmenopausal women with disease progression following anti-estrogen therapy. Fulvestrant is an ER antagonist that produces downregulation of ER protein. It is an analog of estradiol that acts as a competitive antagonist. Fulvestrant is administered intramuscularly. The adrenal gland is the primary source of estrogen after menopause. Aromatase is an enzyme responsible for converting androgens produced by the adrenal gland into the estrogens, estrone, and estradiol in the peripheral tissues. Aromatase inhibitors block this process. Anastrozole and letrozole are non-steroidal aromatase inhibitors and are potent inhibitors of serum estradiol levels. Exemestane is a steroidal aromatase inhibitor. It is a more potent inhibitor of estrogen than the other aromatase inhibitors. So shows that the strength of the tablet here of all the different aromatase inhibitors. Verzenio, Ibrance, Kisqali, Tykerb, Nerlix are key. Verzenio, Ibrance, Kisqali, Tykerb, and Nerlix are kinase inhibitors that are indicated for the treatment of hormone receptor, HR positive, HER2 negative advanced or metastatic breast cancer in postmenopausal women. They're used in conjunction with an aromatase inhibitor as initial therapy or with fulvestrant in women with advanced metastatic breast cancer. So we have them in this table here. And we have all of the different dosage forms and strengths. So you can see most of those are tablets. There's one that can be, it's a tablet that can be used for suspension. Taxanes are cytotoxic drugs that are naturally derived from the Western yew tree and European yew tree. They are approved for the treatment of breast cancer. A common ending for taxanes is Taxol. Taxanes interfere with the process of mitosis. Mitosis is a key step in the process of cell division and is the stage at which DNA is organized and distributed. So we have our chart with the taxanes. They're all injections. And then the last one, Abraxane, is a powder for a suspension vial. Hexabipolone and Eribulin are microtubule inhibitors. Eribulin is isolated from the marine sponge. Both drugs are used to treat metastatic or locally advanced breast cancer. Like taxanes, hexabipoline interfere with cell mitosis, and drug action leads to cell death. These are solutions for injection and a powder for injection. Pertuzumab and trastuzumab are monoclonal antibodies that are used in the treatment of HER2 positive breast cancer. HER2 positive tumors are characterized by increased invasiveness and cell proliferation to other sites like metastasis and decreased cell death. A common ending for monoclonal antibody immunotherapeutic agents is MAB. So here we have the pertuzumab, and that is a solution for infusion, and the Herceptin, Ogivri, and Cadilsa are all also powder for injection. And then there's a kit, but it's not available here, so we don't care about that. Bonadotropin releasing hormone is also known as luteinizing hormone releasing hormone. Goserelin is a GnRH agonist indicated for the treatment of prostate cancer in men and advanced breast cancer in premenopausal and perimenopausal women with ER-positive disease. Goserelin is given to patients with hormone-dependent advanced carcinoma of the prostate when used for the treatment of prostate cancer. It is used in combinations with anti-androgens and radiation therapy for the management of locally advanced or bulky carcinoma of the prostate. When it's used for treatment of breast cancer, GnRH agonists may be prescribed to treat premenopausal women, whereas SERMs and aromatase inhibitors are only indicated for use in postmenopausal women. So it is an implant, either 1 month or 3 months. Estromycin is an anti-microtubule agent that has anti-gonadotropic effects. It is approved for the treatment of hormone refractory prostate cancer. It can also inhibit DNA synthesis and cause dose-related DNA strand breaks. It's only available as a 140 milligram capsule. Lung cancer may be treated with surgery, radiation, chemotherapy, immunotherapy, and targeted agents. Pharmacotherapy includes platinum-based compounds. Agents used for immunotherapy are monoclonal antibodies, EGFR tyrosine kinase inhibitors, anaplastic lymphoma kinase inhibitors, BRAF and MEK inhibitors, and programmed death receptor and programmed death ligand blocking antibodies are targeted agents used to treat non-small cell lung cancer. Gylotrif, Zycadia, Tarceva, Iressa, these are all kinase inhibitors that are used in the treatment of lung cancer. They block signaling pathways that are needed for tumor growth and spread to other parts of the body. All of those are capsules. Antimetabolites are chemotherapeutic agents that work most effectively against rapidly dividing cancerous cells. They inhibit normal DNA synthesis by forming abnormal nucleic acid base pairs, resulting in abnormal DNA. MTX is structurally similar to the vitamin folic acid and inhibits folate metabolism, which is essential to the formation of the purines. The warning label, avoid aspirin, APAP, and NSAID should be applied to the prescription vials for MTX because these drugs may decrease MTX clearance and cause toxicity. APAP is abbreviation for acetaminophen, and NSAIDs are non-steroidal anti-inflammatory drugs like ibuprofen and naproxen. So we have our antimetabolites in our chart here. So you can see methotrexate has quite a few different dosage forms and strengths. Mercaptopurine is available as a tablet and a suspension. And Nipent is available as a powder for injection. Tecentriq, Opdivo, Keytruda, those are all also monoclonal antibodies that are used in immunotherapy non-small cell lung cancer. Keytruda and Opdivo are classified as PD-1 blocking antibodies. Tecentriq is a PD-L1 blocking antibody. And the PD-1 stands for program death receptor, and the PD-L is program death ligand. These are all solutions for injection or infusion. Colorectal cancer is treated with surgery, radiation, chemotherapy, immunotherapy, and targeted agents. Chemotherapeutic agents include fluoropyrimidines, MTX, methotrexate, and platinum compounds. Carboplatin, cisplatin, and oxaliplatin are platinum compounds. Cisplatin is FDA approved for the treatment of testicular and ovarian cancers, and carboplatin is approved for the treatment of ovarian cancer. Oxaliplatin is approved for the treatment of colorectal cancer. Platinum compounds do have the common ending of platin. The action of platinum compounds on purine bases, adenine and guanine, results in the formation of faulty cross linkages and defective DNA. So for the platinum compounds, they have it just listed all generics except for aloxatin, which is the oxaliptin. Capecitabine, cytarabine, gemcitabine, and 5-fluorouracil are fluoropyrimidines, also known as fluorinated pyrimidines. These drugs are indicated for the treatment of several cancers such as colorectal cancer, leukemia, gastric cancer, basal cell carcinoma, metastatic breast cancer, lung cancer, ovarian cancer, and pancreatic cancer. So we have the fluoropyrimidines used in the treatment of colorectal cancer. Xylota, it's a tablet. The fluorouracil is a solution intravenous. It does come in a cream, in a topical solution as well. Camptostar and Anavide is a topoisomerase inhibitor that is indicated for the treatment of colorectal cancer. The other drugs in this class are used to treat various other cancers. Vipecid is indicated for the treatment of testicular cancer, small cell lung cancer, and non-small cell lung cancer. Hycamptin is indicated for the treatment of ovarian cancer, cervical cancer, and small cell lung cancer. Etoposide is a semi-synthetic derivative of an extract from the mandrake plant. Irinotecan and topotecan are derived from Capototheca acuminata, a Chinese tree, if that's how you say it. Common endings for topoisomerase inhibitors are poside and tecan. And then we have our list here. So it looks like the hycamptin and the etoposide are available as capsules and solution for injection. The Camtosar is only available as a solution for injection. Avastin is used for the treatment of several cancers, including colorectal cancer. Melanoma is treated with chemotherapy, immunotherapy, and targeted agents. Tafinlar, Mekinist, and Zolberaf are kinase inhibitors that are used in the treatment of melanoma. The Taflinar and the Mekinist are also used in the treatment of non-small cell lung cancer. And these are all tablets or capsules. Opdivo and Keytruda are PD-1 blocking antibodies that are indicated for metastatic melanoma and non-small cell lung cancer. Megestrol acetate and medroxyprogesterone are progestins. Megestrol is approved for the treatment of inoperable advanced metastatic cancer of the endometrium and breast, as well as palliative treatment for advanced stage hormone responsive prostate cancer. Megestrol suspension is prescribed also to increase the appetite and combat the wasting syndrome in patients with AIDS and cancer. So we have the megestrol acetate. It's a suspension and also available as a tablet. Medroxyprogesterone is talked about in chapter 27. Immunotherapeutic agents that have not yet been approved for the treatment of endometrial, cervical, or ovarian cancer. However, several studies are ongoing. Alkalading agents are one of the oldest classes of antioplastic agents. They are related to nitrogen mustard, a lethal gas that was used for chemical warfare in World War I. Cyclophosphamide, busulfan, ifosfamide, melphalan, mustarine, and lucron are all alkylating agents. Only cyclophosphamide and melphalan are approved for the treatment of one of the top 6 cancers described in this chapter. Cyclophosphamide is indicated for breast cancer and ovarian cancer, as well as Hodgkin's disease, non-Hodgkin's lymphoma, ALL, multiple myeloma, chronic lymphocytic leukemia, mycosis fungoides, and retinoblastoma. Melphalan is indicated for ovarian cancer and multiple myeloma. So melphalan is only available as a tablet and a powder. Cyclophosphamide is a capsule, a tablet, and a powder for solution. Doxorubicin, epirubicin, and idarubicin are anthracyclines. Methoxytrone is a related compound and is classified as an anthracinidone. Doxorubicin is indicated for the treatment of numerous cancers such as ovarian cancer, bladder cancer, lung cancer, Hodgkin's disease, leukemia, gastric cancer, soft tissue sarcoma, and thyroid cancer. Doxorubicin liposomal is approved for the treatment of ovarian cancer, Kaposi sarcoma, and multiple myeloma. Doxorubicin and epirubicin are indicated for the treatment of breast cancer, typically in combination with other antioplastic agents. Idarubicin and methoxytrone are approved for the treatment of acute myelogenous leukemia. Anthracyclines damage cellular DNA and inhibit the DNA and RNA enzymes that promote protein synthesis. This impairs DNA replication and the growth phase of the cell life cycle. Anthracyclines also inhibit the activity of the enzyme topoisomerase as a secondary mechanism for cellular destruction. Doxorubicin is a prodrug that is metabolized to the active metabolite idarubicin. And then we have all of the dosage forms and strengths listed here. Navalbine, vincristine, and vinblastine are Vinca alkaloids. They are naturally derived from the periwinkle plant. Navalbine is used for the treatment of non-small cell lung cancer. Vinblastine is indicated for the treatment of breast cancer, Kaposi syndrome, Hodgkin's disease, non-Hodgkin's lymphoma, and testicular cancer. Vincristine is indicated for the treatment of leukemia. A common beginning for Vinca alkaloids is Vin. And vincristine should usually be stored in the refrigerator. So these are all solutions or powders for injection. Bleomycin, dactonomycin, and mitomycin are antioplastic agents approved for the treatment of various cancers. Bleomycin is indicated for the treatment of cervical, penile, testicular, and vulvar cancers, in addition to Hodgkin's disease and head and neck cancers. Dactinomycin is indicated for the treatment of testicular cancer, choriocarcinoma, and rhabdomyosarcoma. Mitomycin is approved for gastric and pancreatic cancer. Mitomycin is also indicated as an adjunct to glaucoma surgery. And the dosage forms and strengths are listed here. So we always want to exercise precautions for handling, preparing, and administering cytotoxic drugs. Obviously, this will be a given if you're in the hospital working in a clean room, but you also have to take into consideration that we do come in contact with some cytotoxic drugs in the retail pharmacy side, depending on where you work and what you do. So it is also important to exercise those precautions when you're working in a retail pharmacy. So these are the summary of drugs for the treatment of breast, prostate, lung, colorectal, skin, uterine, and ovarian cancer. We went over all these before, but we have the warning labels we'll go over. So for the selective estrogen receptor modulators, those should be avoided in pregnancy, which we talked about earlier. Chloromethine should be avoided with grapefruit juice. For the estrogen receptor downregulator, fulvestrant, also should avoid pregnancy, refrigerate, do not freeze, and store in original container, and that should also be protected from light. For the aromatase inhibitors, also avoid pregnancy, take at the same time each day with a drink of water. For the exmastocene, take with meals. And for letrozole, it may cause dizziness or drowsiness. For the gonadotropin releasing hormone agonist Zoladex, avoid pregnancy, store at room temperature. For Megace, the progestin, for the suspension, we just want to shake well, like any suspension. For the kinase and mTOR inhibitors, we're going to swallow whole, do not crush or chew for these medications. Avoid grapefruit juice and or pomegranate juice for these medications. Take on empty stomach for these medications. Take with food. All of them should be taken as directed and don't skip. That's very important for cancer medications. Avoid pregnancy. All of those are listed. Avoid prolonged exposure to sunlight. That one is only affected by erlotinib and vemurafenib. Dissolve in 48 ounces of water, then drink solution, and that is going to be for the affiniter, disperse, and avoid acids with these drugs, and refrigerate, do not freeze for the trametinib. For the anthracyclines, we are going to avoid pregnancy. We're going to shake well, the powder for injection. We're going to protect from light. We're going to inform the patient that the medication doxorubicin can discolor their urine. Metaxatrone should be stored at room temperature. And for all of these medications that were powders that we're going to turn into solutions for, not solutions, but they're still going to be a suspension. But when we add water to reconstitute them, we always want to make sure we're shaking well so no medication is left inside the vial. For the taxanes, for Dose Taxol, we can avoid pregnancy, do not shake. For that one also, refrigerate, don't freeze. And here is the stable for certain lengths of time for some of these medications. Store at room temperature, protect from light. Do not mix in PVC bags or use PVC sets for the doxylotaxel and the paclitaxel. Avoid aspirin, APAP, which is acetaminophen, and NSAIDs. For the fluoropyrimidines, for fluorouracil, that one, once the pharmacy bulk vial is open, any unused portion has to be discarded after 1 hour. So that's important to remember. Avoid pregnancy, avoid prolonged exposure to sunlight, avoid aspirin, acetaminophen, and NSAIDs, store at room temperature, and protect the drug from light. For the capecitabine, we're going to tell the patient to take with food, avoid pregnancy, avoid aspirin, APAP, and NSAIDs. For the antimetabolites, we're going to protect from light the methotrexate, store at room temperature, reconstitute powder. Take with a full glass of water, may make skin more sensitive to sunlight, avoid pregnancy, do not drink alcoholic beverages with methotrexate, refrigerate and use within 24 hours of reconstitution, discard any unused portion. For the Vinca Alkaloids, refrigerate, do not freeze, protect from light, avoid aspirin, APAP, and NSAIDs. These syringes should be labeled for IV use only, fatal if given intrathecally. For the platinum compound, same, avoid pregnancy, avoid aspirin, APAP, and NSAIDs, which is a common warning for most of these. Stable for 28 days once the vial is open and penetrated. Protect from light, store at room temperature. Reconstituted solution is stable for 24 hours if refrigerated. For the topoisomerase inhibitors, for the etoposide capsules, take with a full glass of water, swallow whole, do not crush or chew, avoid pregnancy. The reconstituted solution is stable for 24 hours at room temperature. For the microtubule inhibitors, we have quite a few different ones. Avoid pregnancy for all of these. Avoid aspirin, APAP, and NSAIDs for all of them. Eribulin can be stored at room temperature. MCIT should be taken on an empty stomach and avoid dairy products within 2 to 3 hours of dose. The exabepilone is able to produce dizziness or drowsiness, so we should avoid pregnancy as well. The reconstituted solution is stable for 6 hours at room temperature. For the monoclonal antibodies, we're going to refrigerate, don't freeze these medications, protect from light, do not shake, and avoid pregnancy. For the PD-1 and PD-L1 blocking antibodies, those are going to be refrigerated, not frozen. Do not shake, avoid pregnancy, and protect from light. The cytotoxic T lymphocyte antigen 4 blocking antibody, we're going to refrigerate, don't freeze, avoid pregnancy, and protect from light. And we have porphymer for a miscellaneous agent, and that should be avoided in pregnancy and protect eyes from the sunlight.